Measles is returning, and it's more serious than many realize.
Today, we're diving deep into why this once-controlled disease is surging again in the United States.
What makes it so dangerous, and most importantly, how we can protect ourselves and our communities.
Stick around because we'll cover the latest facts, the real risks, and simple steps everyone can take to help stop the spread.
This could save lives. Let's get started.
For over 20 years, the U.S. had successfully eliminated the ongoing spread of measles thanks to widespread vaccination.
A huge win for public health.
Before the vaccine became available in the 1960s, almost every child caught measles. Many faced serious complications like pneumonia or hearing loss, but in 2025, things changed dramatically. The Centers for Disease Control and Prevention reported a total of 2,281 confirmed measles cases across the United States, the highest number since the disease was declared eliminated in 2000. These cases appeared in 45 jurisdictions, with 49 separate outbreaks. Most infections were among children and teens, and sadly, there were 3 confirmed deaths. The first measles-related fatalities in the U.S. since 2015. One of the largest outbreaks centered in West Texas, where over 760 cases were confirmed. 99 people were hospitalized there, and 2 unvaccinated school-aged children tragically lost their lives. That outbreak was officially declared over in mid-August 2025 after more than 42 days without new cases. Other areas saw heavy impacts too, including a major ongoing outbreak in South Carolina that grew significantly,
And reports of a measles-related death in New Mexico.
These numbers are alarming because measles is one of the most contagious viruses we know.
If someone with measles is in a room, the virus can hang in the air for up to 2 hours after they leave. 9 out of 10 unvaccinated people who are exposed will catch it.
Far more contagious than flu, COVID-19, or even Ebola.
Symptoms don't appear right away, usually 7 to 14 days after exposure. Early signs like fever, cough, and runny nose look a lot like a common cold or flu, making it hard to spot at first. Later, tiny white spots may show inside the mouth called Koplik spots, though they're often missed or absent.
Then comes the classic red rash.
The problem? A person is highly contagious for days before the rash appears.
So by the time we realize it's measles, many others may already have been exposed.
Measles isn't just a mild childhood illness. It can lead to serious complications, especially in young children under 5, adults over 20, pregnant women, and those with weakened immune systems. These include pneumonia, brain inflammation that can cause seizures, or long-term issues like hearing loss or intellectual disability.
Eye problems that may affect vision, and in rare cases, a fatal brain disease years later.
In up to 3 out of every 1,000 cases, measles can be deadly. In the 2025 outbreaks, about 1 in 10 cases required hospitalization. There's another hidden danger. Measles can temporarily weaken the immune system. Research from Harvard Medical School showed it may erase a large portion of previous immune protections against other infections, meaning someone who recovers from measles could be more vulnerable to things like flu or pneumonia for months or even years afterward. The good news? We have a highly effective tool, the MMR vaccine. Two doses provide about 97% protection, one of the best rates for any vaccine. When fully vaccinated, cases are usually milder and much less likely to spread. And the vaccine is very safe. Common side effects are mild, like a sore arm, low fever, or tiredness. Similar to most shots.
Claims linking the vaccine to autism have been thoroughly studied and debunked by major health organizations worldwide.
So why are we seeing this resurgence now?
Vaccination rates have dropped.
Nationally, among kindergarten children, MMR coverage fell from around 95% in 2019 to about 92-93% in recent school years. In Texas, kindergarten rates dipped below 95% in many counties.
And in some outbreak areas, they were as low as 82%.
When community rates fall below 95%, herd immunity weakens,
And outbreaks can take hold quickly.
Of the recent US cases, only about 4% were in people known to be fully vaccinated. The vast majority, over 90%, were unvaccinated or had unknown status, with a small portion having just one dose.
The bottom line is clear. These outbreaks are preventable.
When vaccination rates stay high enough, measles stays under control. We've done it before.
But with rates declining in many places, experts warn more cases and potential tragedies could happen if we don't act. Here's what you can do right now to stay protected.
First, check your vaccination status. Children typically get the first MMR dose around age 1 and the second between 4 and 6.
If you're unsure about your own history, especially if born after 1957 or vaccinated before 1968, it's okay. Let's check your records together. Talk to your doctor. They can recommend a dose or a simple blood test for immunity.
If you're planning travel to areas where measles is circulating, make sure you're up to date.
If someone in your household gets sick with suspected measles, isolate them and wear masks to limit spread. Frequent hand washing helps too.
And if you're vaccine hesitant, that's okay. Ask questions. Talk to a trusted healthcare provider and look at information from reliable sources like the CDC or WHO. Measles is making a comeback, but we have the power to stop it. Vaccination works. It's safe. It's effective.
And when we all protect ourselves and each other, we protect the most vulnerable.
Thanks for watching all the way through. If this helped you understand the situation better, give it a like, subscribe for more clear, fact-based health updates,
and share it with someone who needs to hear this. Drop a comment. Have you checked your MMR status lately?
Let's keep the conversation going and keep each other safe. See you in the next video.